This brings me to a few more questions that we have from our audience. I think it'll be really great if we get some answers for this. This question is, how often do they need to clean their surfaces? So we're talking about, again, in the house where people are staying right now. How often do you think one needs to clean these surfaces? Because we are hearing the virus now stays on the surfaces.
Yeah, so if we look at some data from New England Journal of Medicine, they recently published an article a few weeks ago talking about how long the virus is can be found on different surfaces. And what they concluded was that you can find this virus on copper surfaces for up to 4 hours, on plastic for cardboard for up to 24 hours, and plastic and stainless steel for up to 72 hours. So if we keep that, and then we also have other conflicting data stating that they found the virus in these cruise ships 17 days after when people had abandoned the ship, essentially. So I think this is very debatable. But if we think about this from the concept of being cautious, I think wiping down high-touch surfaces such as phones, keys, doorknobs, at least 2 or 3 times a day is probably a good idea, especially depending on how many people are coming in and out of the home. If you come home once and you're staying home and you've done everything from your end to remain hygienic and using soap and water and wearing masks when you went out, then you probably can wipe it down once. But if you have an individual who is going in and out of the house 2 or 3 times, they had to go to the grocery store, they had to go to the gas station, I think then in those situations, wiping things down more than 2 or 3 times may even be reasonable. So I think it really depends on every individual situation.
And Dr. Chopra, do we need to wear masks and gloves? A very popular question we ask every doctor here. Do you think when we're stepping outside, we're going to the groceries, we're going to pharmacy, or making these runs that everyone has to do normally here, do you recommend that they wear masks and gloves right now?
Yeah, a mask I think is definitely something mandatory, because you don't know if anyone's going to sneeze on you or cough on you, or if there's any aerosolized particles anywhere. The glove I think is maybe potentially debatable. It's probably not a bad idea, but you have to realize just because somebody's wearing gloves, but then you're using those hands that have gloves on them to touch your keys, touch your doorknob, you put those hands in your pocket, then it defeats the whole purpose of having a glove. So having a glove is reasonable if you're not touching your face, you're not touching your eyes, and you're still cleaning all the surfaces that the gloved hand touched. So it's reasonable, but I don't think it's necessarily mandatory.
Another question that we have here is, what are some of the symptoms to definitely watch out for COVID?
Yeah, no, that's a good question. If you look at the data, symptoms of fever, cough, whether it's dry or productive, and shortness of breath, these are the main symptoms that people usually present with. And I think those are the symptoms that everybody should be concerned about if they are having it. If someone is just having isolated cough, sore throat, or runny nose, or isolated body aches, I think it's something that you can just keep an eye on. Right. But if somebody's having high grade fevers that's not getting better, they're having this worsening cough, they were shorter breath with 1 flight of stairs yesterday, and now they're shorter breath on walking on a flat surface, these are all symptoms that are pretty concerning.
And one last question from our audience, definitely we want to know, how often should one wash their hands? Because it's all about washing hands, all about maintaining a good hygiene. That's something that we're stressing, but how often do you think we should really, honestly, according to you, wash our hands?
Yeah, again, it depends. If you're staying home all day, once or twice, whatever is your usual habitual routine of washing hands is probably reasonable.
Right.
But it's more important to make sure you wash your hands when you are going in and out of your so-called clean environment. If somebody's going to work and coming back, it's a good idea to wash your hands every time you touch something that you normally do not touch. So at least a few times a day is a good idea. But if you're home, then whatever your habitual routine of washing hands is, that is probably adequate.
In terms of looking at high-risk patients, And there are a lot of South Asian Americans that are at high risk with a lot of chronic lung diseases, heart diseases, cholesterol, blood pressure, diabetes. And also with your expertise in sleep medicine, and as well as the lungs itself, what are some of the concerns when it comes to patients that have these chronic conditions? And also, if they're watching you on ITV Gold, what are certain things you would recommend that they watch out for right now,
Yeah.
especially?
Yeah, no, especially if somebody has multiple comorbidities and their age is above 60, 65, it's best that they stay home and give the opportunity to the younger people in the family to help them out or do save up for them or whatever it is that that needs to get done.
Mm.
Specifically, if they have any underlying lung disease, COPD, uh, pulmonary fibrosis, asthma, if they have any congestive heart failure, if they've had stents put into their heart, if they have diabetes, if they have high cholesterol, if they've had strokes in the past. These are all, if they have chronic kidney disease,
Right.
these are all individuals that if they do end up getting sick, the chances of recovery are lower as well as the chance of them getting sicker is higher. So it's best for these individuals really to just stay home.
Right.
If they don't have an option and they have to leave their home, definitely wear a mask and wash your hands every time you touch something that you don't routinely touch.